Hello, everybody. I want to show you a nice example of the power of the MAMA-CT in actual diagnostic imaging. What you see is a VRT of the right breast after MAMA-CT, which is performed here with a high resolution of 0.15 millimeter in every direction. So you have an isovolumetric matrix and a very high resolution. The whole examination with contrast is done in less than 5 minutes for both breasts, and the dosage you come out is the same as you are producing with a plain mammography in 2 ways. So starting with the VRT, you see the rotation in every direction, and the reason why we did this CT is that the patient get an MRI in another institute a few weeks before, and they say, okay, you don't have to worry. There's only a maybe benign lesion in your right breast at 3 o'clock. It takes some contrast, but it seems benign. So it's a BI-RADS 3 and you can come back in 6 months. But when you take a look at the MAMA-CT and you're changing the parameters, you have to take at least only 2 seconds to realize that this is a malignant lesion at all. It is an unsharp lesion with a heavy intake of contrast. You can measure it right on. It's 0.7 millicentimeters, and you see also the distance from the nipple. And with this 3D imaging, you can really easily make it clear to your patient, to your colleagues, all the surgeons, what is going on and what they have to do. You see the image quality, you see the vessels with contrast, you see the musculus pectoralis in the depths, and you can also have a look at the normal rendering of the images. So these are coronal images, normal MPRs. In a coronal view, you can take a look at the CC rendering and clearly see the unsharp delineation of the tumor and the contrast intake, and also in a lateral view like the lateral mammography. But to show you the competition between the CT and the MRI, I took the older images, an MRI which I get at least last week, and you see the intake of the contrast, but in MRI you can figure it out maybe as a sharply delineated lesion. You see the contrast enhancement, and also the ultrasound wasn't quite clear. It was a hyper-intensive, hyposensational lesion with some sharp delineation and no shading at the back. So to go back to the MAMA-CT, this is really a nice case to have a look at this again. Clear diagnosis after 5 minutes and 1 examination. Thank you very much for your attention. Bye-bye.